Dear Dr. Tedros, we are very honored to meet you in person. Thank you for considering our appeal, an appeal made to all ministers of health and their representatives of the member states who are now at the 74th World Health Assembly. This is an initiative of Doctors for Extinction Rebellion and other movements. They are all here in front of you. We are supported by the Global Climate Health Alliance and the Global Strategic Climate Communications. Already at the COP21, the WHO alerted the world. Climate change is the greatest threat to global health in the 21st century. As frontline health workers, we are confronted every day with the consequences of environmental deterioration on the health of our patients and communities. I'm just back from Africa and I saw it again. I worked there and I was really stricken, and it's happening in the north also now. So what we see are respiratory and cardiovascular diseases due to air pollution, lost work days and death due to heat waves, over and undernutrition due to lack of quality food, diarrhea and poisoning due to polluted drinking water, and also psychological distress due to natural disasters and loss of hope. Unfortunately, health professionals are not listened to, nor are scientists in general. Global warming is not only an existential threat for future generations, but a reality now. This is especially dramatic in tropical countries, where malnutrition is again on the rise. Despite accumulating evidence and repeated warnings from climate scientists, despite more frequent and severe natural disasters, including the COVID-19 pandemic, the concrete actions implemented by our governments are far from sufficient in view of the urgency of the situation. In the face of inertia, inaction, and the abysmal gap between speeches and action, we, the health professionals, demand that the health authorities in each country publicly declare that climate change is putting people at risk of death. We demand that the health authorities act now to preserve life. You, health authorities of the member states, are responsible for making climate change and biodiversity loss the #1 public health issue. You, the health authorities of the member states, are responsible for rapidly restoring a safer climate and ensuring the best possible protection for all, especially the most vulnerable. You, the health authorities of member states, are responsible for forcing your governments to comply at a minimum with the Paris agreements. You, the health authorities of the member states, are responsible for acting in your field, the field of health. Here are some concrete action. Give priority to prevention and health promotion. Promote a more sober, more human, more equitable medicine, especially here in Switzerland. Develop environmentally friendly medical practices and health infrastructures. And also involve the population and patient in strategic choices. Dr. Tedros, we ask you to relay our concerns and determination to the ministers and representatives of member states attending the World Health Assembly. We ask the WHO to be the driving force and guarantor of public policies that respect the health of all and preserve life. The urgency must be declared and proposal for implementation developed both this week and at the G7 summit in the UK in June. As health professionals, you and we are responsible for the health of our population. That it is why we must act now. Thank you for your warm welcome. We wish you a fruitful World Health Organization Health Assembly, especially on the burning issue of climate and health. We count on you.
Merci beaucoup, Valérie. Thank you.
Jeanne, I'm a nurse, and here is the letter for you.